Hello, my name is Haider Abdul Mohsen. I'm a urologist, and I have a specific academic interest in the endourologic and minimally invasive management of multiple urologic conditions, including prostate cancer. Today, I would like to talk about the use of multiparametric MRI, or MRI in general, in the diagnosis, in the evaluation, and even sometimes in planning management for prostate cancer. Prior to discussing the multiparametric MRI, I would like to briefly review how we used to diagnose or screen patients for prostate cancer in the past before the introduction of this new imaging modality. The diagnosis used to rely on digital rectal examination that will be done by your primary care physician or by your urologist, in addition to a blood test that is called the PSA. If any one of these two tests is worrisome, then your provider may ask you to further explore the possibility of having cancer by doing an ultrasound-guided biopsy. This is a biopsy that utilizes ultrasound in order to guide the needles into the prostate tissue and try to pick up cancer. Ultrasound is a great imaging modality since it is safe and it's very available, but it has the limitation that it does not identify the regions that look suspicious inside the prostate. MRI, on the other hand, is a cross-sectional imaging modality that uses a high magnetic field and try to alter the motion of the water atoms or particles inside your body. And this is translated by a computer system into a certain type of image that a special radiologist would look at and will interpret for us. Multiparametric MRI uses a combination of advanced techniques to look at your prostate and try to identify areas that does not look normal. Abnormal areas may be cancer or maybe just a benign prostatic enlargement. And that's why the MRI would not end up diagnosing you or ruling out prostate cancer completely, but it significantly helps you and your provider to see if there is any suspicious areas inside the prostate. If you have already done this imaging modality by the time you're watching this video, probably you are familiar with something called the PIRADS scoring system. It's basically a system that ranges from 1 to 5, with 1 being the least suspicious area inside your prostate, and 5 is when there is a lesion that is very suspicious based on certain characteristics to the radiologist and requires a biopsy. In today's practice, it's very common to recommend that a patient would need a biopsy if the PIRADS scoring system of a certain lesion is a 3 and above. And that's when you will be referred to your urologist again, who would consider doing an MRI ultrasound fusion biopsy. What do we mean by that? On your end, this is just like any other biopsy where there will be an ultrasound probe introduced through the rectum, and then scanning images will be obtained. The urologist and his team, typically nurses who assist him during the procedure, would try to fuse these images to the best accuracy that they can get. And what eventually will happen, that the urologist will look at an ultrasound image and see target lesions inside the prostate that would guide him to where these suspicious areas were during the MRI. And that's what we mean by fusion. Then he would introduce the needle, biopsy those in addition to a conventional regular biopsy. One additional benefit of the MRI in imaging for prostate cancer is that it has a good sensitivity and accuracy in looking at the lymph nodes in your pelvis and looking at the bony structures. Additionally, it may have some benefit in looking at the lesion and see if that lesion is completely confined inside the prostate, meaning that it did not cross the boundaries of the prostate, or if it started doing so and invaded some adjacent structures such as the bladder neck, or the neurovascular bundle, which are the nerves that convey signals for erection, or the sphincter that controls your urine. And this may have a significant impact sometimes on the decision-making process related to the best management strategy that you may need. I would like to briefly illustrate to you what to expect when you are scheduled for an MRI. If you had a discussion with your urologist and he thought that you may benefit from this test, you typically go to an imaging center where you will be lying flat on your back for approximately 30 to 45 minutes. The radiology technicians will go through a checklist to make sure you don't have any problem going through this big magnet, such as you don't have a foreign body or you don't have a metallic implant that may affect the quality of the images, or sometimes they can move during the process of imaging. You would be asked to stay still as much as you can. If you have a condition called claustrophobia, which is inability to go in tight places where you have significant anxiety or sometimes panic attack, you should tell your providers about that. You may benefit from a certain subtypes of MRI which have an open space called the open MRIs, or you may need some calming medicines such as Valium or something like that prior to the test. Sometimes they do introduce a probe, which is a finger-sized instrument inside the rectum in order to enhance the quality of the MRI. An IV line may be inserted into your arm vein, and you may receive a contrast called gadolinium. This contrast is different from the most commonly used contrast, which is the iodinated contrast, meaning that if you have allergy to that type of contrast, you may safely undergo the MRI still. In addition to that, if you receive this contrast, the contrast does not really result in deterioration in your kidney function if your kidney function was somewhat abnormal, but you should tell your provider that you do have an abnormal kidney function if you do, because giving this contrast in your body will accumulate in your joint and will cause a bad condition that may significantly impair your quality of life afterward. This is commonly referred to as NSF, or nephrogenic systemic sclerosis. Prior to the biopsy, the urologist may do some blood tests to make sure you do not have a urinary tract infection. They may give you an enema prior to the procedure in order to clean your rectum and somewhat decrease the risk of infection. You will receive some form of antibiotic to decrease the risk of infection prior to the biopsy, which can be given either in the oral or sometimes in an injectable form on the day of the biopsy. You will be lying flat or on your side, and the probe will be introduced through the rectum. Typically, we start by injecting a numbing medicine around the nerves that supply the prostate. This will allow you to have a painless procedure or a procedure with very minimal discomfort. Following that, multiple images and scans will be taken. And finally, the urologist will introduce the needle into these regions of interest or suspicious areas inside the prostate and take multiple samples from them. The benefit of doing this sometimes is that we can still do the conventional biopsy and do a random or somewhat random sampling of your prostate. Following the procedure, you should expect some blood in the urine, blood with a stool, or blood with a semen. Typically, blood in the urine or blood in the stool will take a few days and will resolve on its own. Sometimes it represents a problem and you need to tell your provider if you're passing clots or if you are unable to pass urine. One of the most feared complications following biopsies is the development of a significant urinary tract infection in the form of fever or what we call as sepsis. If you feel ill within 24 to 48 hours after the biopsy, or even after that, feel free to contact your provider and inform him about that. You may need to be brought to the hospital, and you may need to be admitted to receive IV antibiotics and placed under observation. Fortunately, this is not a very common complication. However, it's still a significant one when it happens. One of the very important topics related to multiparametric MRI is when do you need it? One of the most commonly encountered indications in today's era is to recommend a multiparametric MRI in a gentleman who has a suspicious PSA, he has a strong family history, the urologist is worried about him having cancer, but all the conventional biopsies are negative. You may have one or multiple biopsies, and you want to do the best type of biopsy in order to rule out cancer. And that's when your urologist would recommend doing an MRI and fusing the images at the time of the biopsy and do a better biopsy. Other indications for that have been recently explored is just trying to use MRI prior to any biopsy. And although this is not yet a standard of practice, but there are some encouraging data and there is a shift in the general practice trends toward such a recommendation. Do you need an MRI? This question needs to be discussed directly with your provider and your urologist. The MRI, although it is safe and feasible and doesn't have risk of radiation, but is definitely a test that requires time and it is somewhat expensive. I highly recommend you discuss the need for the MRI, in your case, directly with your urologist, and he will be able to tell you if you do need this and if there's any benefit from doing so. Once again, my name is Haider Abdul Mohsen. Thank you so much for seeking information and visiting our website. Our website is very rich in various educational materials related to various aspects of prostate cancer diagnosis, management at its various stages. If you have any recommendation, we highly encourage you to leave us a comment and to tell us how we can improve this website. Thank you so much.